Here at Robin Hood Radio, we have teamed up with the Foundation for Community Health, and we run a series of interviews every month dealing with who the Foundation for Community Health deals with. I think a lot of people hear the name Foundation for Community Health, and they aren't as aware as they should be as what the Foundation for Community Health gives back and puts into our community by helping other organizations that help you in this community. And that's what this series is all about. And today, very important, we'll talk about something that has been on, I think, everybody knows about it, or 90% of the people know about Geer Dial-A-Ride for residents of the Northwest Corner. Ivana Powers is the Director of Transportation, and we're going to talk to her a little bit about the transportation program and Dial-A-Ride and more at Geer. And we welcome her in this morning. Good morning.
Hi, good morning. Thank you for having me on.
You know, I've known Geer for a long, long time and known about what goes on with the Dial-A-Ride program, but and the different everything else that goes on with Geer and for residents of the Northwest Corner and beyond. But we'll stick with the transportation right now, and this goes back to the Foundation for Community Health. In 2017, you participated in their efficiency study by the foundation. And I guess that was a pretty key point to find out how you could do better what you were doing, get rid of the weak points, and go on to other things that came up in this study.
Absolutely. The Foundation for Community Health was really helping us kind of restructure what the good stuff that we were doing, and to really look at how we can move forward with more efficiency. And with more efficiency, we could provide an increased number of rides for the community on the whole. So one of the significant changes that we made to our program was getting this amazing software program called Route Match, which is a scheduling software and data collection program, and it really helped keep track of all of our data, and it's helping us really shape how we move forward.
And this is what I talk about for the Foundation for Community Health. They don't do the work. What they do is you come to them with a problem, or they see a problem and they go out and study it, and then they come to you and they give you the resources to go out and deal with those problems.
Absolutely. They are a huge piece of our funding for our program, and with them we are able to help the seniors and disabled persons in our community get to their doctor's appointments and have quality of life. Have their personal errands, taken care of, and if they're in a wheelchair, they have safe, reliable transportation. And also if they have walking mobility needs like a walker or cane or anything, we can accommodate their needs as well. So with the Foundation of Community Health, we're able to really help people access what they need to live a really good life up here in the Northwest Corner.
You know, one of the things that helped you out with the Connecticut Office of Policy and Management was the funding for this route match, which you talk about, and the purchase of 3 different vans that you folks see out there on the highway that really supply, especially where we are, such a needed service.
Yeah, I mean, I'm sure you see us whizzing by several times a day over there, and going back and forth to Sharon Hospital. We go all over the place, and yes, the OPM grant really helped us get these wonderful vehicles. We have 2 of these 8-passenger Ford Transit vans. They're extra high, and they accommodate 2 wheelchairs. And 8 people in the van. We also have 3 Toyota Sienna vans that are really fun, really great, efficient vehicles, fun to drive for the drivers, and they look great too. So we're really, really proud of the variety of vehicles that we have for everyone to, and we work here in the office with our riders to make sure that we're matching them up with the correct vehicle, and we do keep track of their needs. And sometimes those needs change. So there's a lot of work here in the office too to work with our riders who call in to accommodate their needs as much as possible.
For people that are listening and don't realize, the Dial-A-Ride at Geer is free, right?
Correct. It is free. We do accept donations, but it is funded by the Connecticut DOT, Foundations for Community Health, and numerous other smaller funds. But also we participate in the RITS program. I'm not sure if you've heard about it. It's called Rural Independent Transportation Service, which is also funded by the Connecticut DOT and the Northwest Hills Council of Government. And this allows us to provide even more rides for people outside of our immediate service area for medical purpose only. But it really just expands our reach, and it's very, very helpful in that area.
How did you adjust? And this is, hopefully we're coming out of it. Maybe we're not coming out of it. But how did you have to adjust your protocols and your safety measures, and what all happened during the pandemic?
Oh wow, yeah, it was a big pivot for us because we were really getting into the swing of greater efficiency. Finding people going to the same locations and kind of they call it multi-loading, putting more than one person on a vehicle and getting to you have greater efficiency when you have more people going to certain destinations. But with the pandemic, we had to kind of really just pull back on all of our really good efficiency standards and stop the multi-loading where we had only one person riding in the vehicle. We increased our safety standards for, we did a ton of sanitation after every rider, before every rider, after every rider, lots of PPE, really good PPE for the drivers, and, really just changing everything we did. It did decrease the amount of rides we were able to give people, but we still stayed open. We kept working really hard, protecting each other, protecting the drivers, protecting the riders. I think one day we'll look back on it and just be amazed at what we accomplished. So I'm really proud of our efforts during that intense time. It's still kind of intense. We still require masks on the vehicles. The drivers wear a mask. The riders have to wear a mask according to CDC and federal guidelines for mask wearing on public transit. But we're doing good. We're doing really good, and we're picking back up. We can start multi-loading again, not huge amounts, but, where appropriate. And with the appropriate size vehicle, we can still maintain a 6 feet distance. And
you also, with the help of the Foundation for Community Health, they helped you install plexiglass barriers in those vehicles, right?
Yeah, they've been helpful in so many ways, including helping us get PPE for the Geer campus on the whole. But the Northwest Connecticut Community Foundation actually supplied the funding for that. And yes, Each vehicle has plexiglass barriers. So between the driver and the rider, you just is one more piece of safety. We hope.
I think what's great about this is people now get to see that there's nonprofits that have to work and fund these things, and we have other nonprofit organizations that help another nonprofit. It really is a one hand helps the other hand community.
Oh, it sure is. I mean, I'm always amazed at the reach of the Foundations for Community Health here in this area. I mean, there's so many different types of programming that they support, and without them, I think we would really feel the loss of their support for the people in this community. It is imperative that the help that they give us and the residents in this area. To maintain good, healthy lifestyle, quality of life again, getting out, going places now a little bit more. It's so important when you look on, a normal person living up here in the corner. On the whole, they really do rely so much on the services that the nonprofits provide around here.
All right, if people want to contact you, what's the easiest way to contact you?
Absolutely. So our Dial-A-Ride hotline, 860-824-7067. We're also on the Internet. Our website is geercares.org. And that's pretty much it. We do need to speak to people on the phone. It is important that we do have an initial intake with each new rider that we take on into our program and get lots of, demographic information, and then we kind of go from there. One more piece I don't want to not forget is that we help residents in this area book appointments with area providers, and I think that's a really important piece of our work here. Is that a lot of people call us and say, I need an appointment with Dr. So-and-so. When can you take me? And so what we do is we call the doctor's office on their behalf with their permission, and we work with their appointment creator there, and we make appointments for them. And I think that's a huge service to cut down on the work for the individual.
All right. For more information, geercares.org. Also, information on the Foundation for Community Health. It's fchealth.org. Thanks for joining us this morning.
Oh, thank you so much. Have a lovely day.
All right, take care.
Bye-bye.
Once again, the Foundation for Community Health and Geer, and the website for the foundation is fchealth.org.